we're going to have another pandemic, influenza pandemic. And when we do, we really need to be prepared. And we need to think about how pregnant women are going to be affected. We planned for influenza, and then while we were finalizing the guidelines, the pandemic hit, and the second death in the United States was of a pregnant woman. And then we worked throughout the pandemic and recommended antiviral therapy for pregnant women for the first time, for all pregnant women, because of the increased risks of disease. And so it just taught me that the importance of being prepared. It's hard for me to remember when I wanted to be a doctor. My mother, when she was alive, claimed that I talked about wanting to be a doctor when I was very young. I didn't remember that. And during college, I actually wasn't pre-med. And in the year off, I worked as a nursing assistant in a hospital in Charlotte, North Carolina. And I was a float, so I worked on all different units, all different shifts, first, second, and third shift. And it really gave me an incredibly unique view of the healthcare system from a very different perspective. And that's been a really great perspective to have throughout my career. Like most things I do in life, Duke was a very carefully considered decision. I applied to a lot of medical schools. I visited a lot of medical schools, including Duke. But I wanted to make a really informed decision, and I was having trouble making a decision. And I remember my father telling me to make a spreadsheet, basically, of all the pros and cons of Duke versus other medical schools. And I decided on Duke in a very evidence-based manner, but it really also matched my heart. I really was excited about going to Duke and loved being at Duke, and loved the fact that the men's basketball team won 2 national championships while I was there in '91 and '92. So it was really such a fun time. At Duke, I did all my clinical rotations during the second year. And when I did my OBGYN rotation, I just loved it. I loved the combination of interesting medicine and procedures and surgery. And I loved, in particular, labor and delivery. You know, women came in labor incredibly uncomfortable and in pain, and then you handed them, in many cases, a healthy baby to go home with, all within 24 to 48 hours. And so I really loved labor and delivery and fell in love with the clinical practice of obstetrics and gynecology. So I loved working at the CDC. It was such an exciting place. I particularly liked working on emergency responses. So then the last major response I worked on during my time at CDC was Zika. We established the fact that this pathogen that had been known but had not had large, broad effects actually caused a congenital syndrome that affected babies. And then we were able to implement some public health measures to ensure that women who did not want to get pregnant didn't get pregnant during this highly risky time. And it's very rewarding and gratifying to be able to work on a major outbreak and feel like you're having impact. At Emory, I really wanted to grow the academic culture. The department had a great clinical enterprise, but there wasn't the focus on research and education and innovation and training that I would like. And most importantly, I really wanted the faculty, the providers, the department to rediscover the joy of medicine and be really excited about what they were doing every day. Iowa has been a breath of fresh air. It's been great being here. I wasn't looking to come here. I didn't know much about Iowa when I came here. In fact, somebody called me and asked me if I was interested in applying for the position. And they said, "Do you ever think about Iowa?" And I said, "Iowa? No, never." And I came and I fell in love with the place. And what I really love about this organization are the people and their stories. I've never met so many hardworking, incredibly humble people. So I've had a lot of fun over the last year asking people, because if you ask them, they'll tell you. Asking people, what do you like about your job? What are you most proud of? And the stories that come forth are incredible. My path in medicine has not been traditional. It's been a little circular or a little winding. Duke showed me that there are a lot of different ways to do things and that I could do things a little bit differently. And I think that I maybe would not have had that confidence if I had not gone to Duke. So Tracy has been my partner for 27 years. And together we had twin boys who are now 18 years old and happily in college. And we, along the way, had a sheep farm in Georgia and now a sheep farm in Iowa. Tracy's a veterinarian. We met at the CDC, and she trains Border Collies to work sheep. And so I would not be here without Tracy. She is the one who stands behind me, who puts up with me, who right from the very beginning has always supported me. And so I feel incredibly lucky to have Tracy and have the boys, and it's been just wonderful.